These are the UK's air ambulances.
17-year-old been hit by a car and is unconscious.
Elite teams taking to the skies at speeds of 190 miles per hour.
Aircraft at Anglia 1 listing.
Got an ETA of 9 minutes.
Specialist pilots, paramedics and doctors
Jack, we're just putting you off to sleep now, OK, buddy?
bring A&E to the roadside
He's got a partial amputation of his forearm.
and countryside.
Life can change in an instant.
Every day is completely unique.
With exclusive access.
No.
Our cameras follow 5 teams across the UK.
As we arrive on the scene, there's always a little bit of adrenaline.
When you've got severe traumatic injuries, every minute counts.
Racing against the clock.
You must go sideways, do not go forward.
Bringing cutting-edge equipment
Can I have some suction, please?
and surgical skills
Tubes through the cords.
to the most critically ill patients.
Don't leave me, darling.
We've taken over his breathing for him.
You can genuinely make a difference.
I have to pinch myself sometimes that my office is a helicopter.
There is no catering today, but there is witty banter and drugs to keep you comfortable.
Oh, that's service with a smile.
Norwich Airport, headquarters of the East Anglian Air Ambulance. Covering an area of more than 5,000 square miles, the charity provides advanced critical care 24 hours a day. It's 7 p.m. and time for the day shift to clock off and the late crew to start their 12 hours on duty. Nicola Ebbs is tonight's doctor, working alongside critical care paramedic Neil Flowers.
Right, should we get rid of this soggy kit?
Yes.
Working for the air ambulance is so much more than a job. It's a real privilege to get to work with an awesome bunch of colleagues. It doesn't feel like work.
So what drugs do we need?
We need 1 rocuronium.
Every time the red phone goes off, you don't know what's happening, you don't know what's coming, and that variability and day-to-day differences in the job is such a unique challenge that I love doing.
Norwich. OK, mate.
It's a crew request to a 71-year-old who's fallen off a ladder. For patients in critical condition, every second counts. The H145 helicopter can reach speeds of up to 167 miles per hour.
Stand by. Stand by. Full security. Roger.
And flying this evening are pilots Paul Smith and Gareth Allen.
Oh, scale left, 15 left.
Roger.
Clear right.
How's clear right?
There's coming left.
Copied. VY and climbing.
Roger.
Anglia 1, go ahead.
Anglia 1, thank you. Looks like it's going to be first on scene.
Yeah, Anglia 1, that's all received. Many thanks.
What's the nature of the job?
Open ankle fracture.
No worries, there's 5 minutes to run.
Lovely.
Just looking at the scene, we've got the Sizewell power station immediately east of the grid. Those look like new houses to me with the orange roofs.
Yeah, and there's all white cable ends just beyond the railway line.
It looks like there's an ambulance then.
Oh, wonderful. Yep, visual.
Visual, yeah. So good access in the 11 o'clock.
Go clear right and below.
Roger.
Anglia 1 on the ground. Doors open, guys. That's all right. Roger, yeah.
The 35-mile flight has taken Anglia 1 just 18 minutes.
Our pilot's doing an amazing job at getting us as close to the scene as possible. However, from the air, it's not always possible to assess just that last little bit of access to be able to get to the job itself.
Despite the ticking clock, it's crucial the crew approach scene calmly and safely.
Got Martin, he's had a fall at 6:45.
71-year-old Martin was doing some DIY when his ladder collapsed.
Leg of the ladder has broken, fallen down.
Yeah.
We have quite a severe open ankle fracture.
Yeah.
Here Got no head injury, no C-spine, no back pain.
Do you mind if I just do a quick repeat primary survey, just to make sure nothing's changed since you did yours?
No problem.
Martin? Yeah. Hello, my name's Neil.
Hi, Neil.
I'm one of the paramedics. And this is Nicola, and you've already met my two colleagues. We know the obvious. We can see that your ankle doesn't look quite right, but just want to make sure.
Martin has suffered an open fracture, dislocation of his lower leg. It basically means that the bone has penetrated through the skin, and that's associated with an increased risk of infection and complication.
No, can I feel your chest? There you go, excellent. And no pain at all? Where did that hurt? Where did that hurt, Martin?
On my ankle.
Oh, OK, so not in your chest?
Oh, no.
No. Any pain in your tummy?
No.
No? And your hips? No pain there? OK. And let's have a little look at everything else. No pain in your upper leg?
No.
No. And down here?
No,
nothing
fine.
else. And can you give the bad leg, give your toe a little wiggle? Good.
No.
And can you feel me touching your foot? Can you feel me touching?
Out. And it just feels like a tickle.
OK.
A primary survey has ruled out major spinal injuries, but the team must give Martin pain relief before they can address his break.
And they'll probably make you'll be awake, but you'll be a bit dozy, and you won't remember anything. And by the time you come round, it should all be done. OK. OK? Yep. Are you normally fit and healthy?
Yeah.
And you're not allergic to anything?
Well, I am, but nothing medically. I had red wine.
Martin?
Yeah.
This should help with the pain, just before we start doing anything particularly interventional.
Neil gives Martin fentanyl, a powerful synthetic opioid which binds to receptors in the brain.
How's the pain at the moment, Martin? Do you want more of this gas and air?
Yeah.
No more of the gas and air. What was you up there doing, Martin?
Started to rain, so we were trying to fix the plastic on the roof.
These things happen. It can't be helped. And it sounds like your ladder's given way on you, doesn't it?
We go to lots of DIY incidents, particularly in the summer when people are outside. They're up ladders, they're doing more things out in the garden. DIY injuries are not uncommon.
Right, Martin, let's give you a little bit more of this.
As Martin is given more pain relief, Nicola contacts the pilots who are waiting in the aircraft.
Surgically, no, it's a nasty open ankle. Plan will be fly to Norwich, if that's OK. We'll get him out, extricated onto the DSA and come round to you guys.
OK, that's all copy, thank you. We'll prep the stretcher. You're all right?
Neil updates Martin's wife, Jane.
Then
I'm here 3 times.
Are you wife?
Yes.
You are, OK.
So 50 years.
Oh.
Martin has been married to Jane for 50 years. I can kind of understand how that must feel. My parents have been married for 50 years, and it must be incredibly upsetting to watch your loved ones suffer such a horrendous injury.
Jane, do you want to know exactly what's going on and what we're doing?
Please.
I think you probably understand that he has definitely fractured his ankle. We've given him some analgesia just to take the edge off of it. We're going to give him a ketamine sedation. He'll stay awake. And the idea is that he'll just be sedated enough that he doesn't really remember what's going on. And that allows us to put it into a splint and then take him off to the hospital. Gets the dressing bag out of the way. Right, so, Martin, just going to give you some medication. This is ketamine. You will stay awake, but you just feel a bit funny, and hopefully you'll have some nice, happy thoughts. Ketamine going in.
Ketamine is a strong sedative which can only be administered by clinicians with enhanced training in anaesthesia.
Okay, that's another little lovely part of the world. How you feeling, Martin?
Woozy.
Bit woozy. Good. That's what we want to hear. So you're going to feel some hands on you in a second, okay?
We're just going to keep you rolled this way.
I'm gonna
Doing ever so well, Martin. Being ever so brave. So, are we all ready?
Yeah.
Okay, so I'll take the head on roll, ready, set, and roll. There you go, Martin.
That's it.
There we go, buddy. Let's straighten you off and make you comfy.
With Martin on the scoop, the team begin the process of transferring him onto the land ambulance for the short drive to the helicopter.
Is everyone happy?
Yeah.
Everyone got a piece?
Yeah.
On lift, ready, set, and lift. There we go.
Did really well, Martin.
Excellent. Let's go. You got it, Ebs?
Yeah.
There you go. All right, Dan, if you're happy, yeah, just slow drive round.
Loud bang. Not a loud bang.
Bear with. Oh, that is a bit of a bump. Just be careful as we go across.
It's raining heavily, so the team transfer Martin as quickly as they can.
Where we go. Everyone ready?
Yeah.
On lift. Ready, set, lift. keep going, keep going, keep going. That's good. Right, so Blizzard, this shiny blanket, let's get it straight over. Okay, so Paul or Gareth, if we do this, can you start getting a bridge on?
Yep. Well done, Martin. You're doing so well.
Is that pain getting worse? Bit of a spasm. Okay, I'll give you a little bit more pain relief, okay? Because you're a bit reluctant on the pain relief, aren't you?
Yeah. Everybody's different. Some people prefer to have lots of analgesia on board.
If you don't want it, you can decline. That's absolutely fine. If you think you can manage...
I think I can.
Okay, but if it gets too much, please just tell me.
I will.
Excellent.
Martin has a high threshold for pain and was not so keen to have analgesia.
All right.
Ready to lift him back?
Yeah, we're all good in the back, thank you.
And we're lifting him. Roger.
Anyone go ahead?
Angle 1, we've lifted from Leyston en route to the Norfolk and Norwich.
Roger that, all received, over.
How much fentanyl and how much ketamine?
Yes, 150 of fentanyl, 40 of ketamine.
1 minute to run them. Visual of the hospital just in the 11 o'clock. I'm going to call landing there.
Copy landing. 300 feet. All clear right and below.
Roger.
Angle 1 on the ground at the Norfolk and Norwich.
Down a lock. It's coming down.
Thank you. Right, we're at the hospital. I'm afraid it's still absolutely raining cats and dogs. And we don't carry brollies, so you're going to get a little bit soggy. We will try and do this as quickly as possible and get you in. My coat is nice and warm. It's been right next to the heater.
Yeah.
I'm going to snuggle you up in that as much as possible.
Right, coming off. Lovely.
Martin will be taken direct to the emergency department, with Nicola improvising some rain shelter.
There we go.
There we go. Well, it's a vomit bowl, but it's keeping you dry, so we'll go with that. We're under cover now, so hopefully you'll be dry
We've
from
got a
now
bit
on.
damp out there.
Martin will be seen by the orthopaedic and plastic surgeons, who will decide on the best course of treatment to fix his complicated fracture. Helimed 55 of Essex and Herts Air Ambulance operates from a brand new base at Northfield Airfield in Essex. The purpose-built helipad has underground heating to combat snow and ice, while the hangar has space for 2 helicopters.
Go for it.
So follow-on bag.
Yeah, so present, green tagged, and we've got 2 and 2.
Yep. Check.
The charity delivers trauma doctors and skilled paramedics to injured patients on scene. And today's team is Dr. Simon Walsh and critical care paramedic Lou Rossum.
Sealed.
Yep.
Stab vests.
So 2 mediums and a large.
Cool.
Happy?
Done. Yep.
Cool. Be nice working together, won't it?
Yeah.
It's been a while.
We've got a varied group of doctors and paramedics, some of whom are working full-time and some, like myself, who are working part-time. So it can be weeks or sometimes even months between working with individual doctors and paramedics.
Right.
Been doing your yoga?
Been taking my cod liver oil.
Happy for me to put these on there once you come out. Cool. See what the day brings.
Speaking.
It's for a 17-year-old male who's been hit by a car and is unconscious.
Okay. We'll get on our way.
Cheers, mate.
The incident is in Luton, 28 miles northwest of the airfield.
Hill looks good to the right. Roger. Okay, happy? Yep. Departing. Roger.
Thank you. Lifted at 1708 at ETA 1721, over.
They're heading to a road traffic collision, car versus scooter, and the patient is a teenage boy.
I'm immediately thinking, has this child got a head injury, even a traumatic brain injury? Have they got spinal injuries? Have they got chest, abdominal injuries? And they're likely to have injuries to their legs.
Where's the scene?
So it's coming down to 2 o'clock at the moment. There's some blue lights. There's 2 fields, one left, one right. That looks like...
Heliwind 55, overhead scene over.
So the obstacles in there are just the goalposts and a few people. We'll come to the right-hand side, aim towards the far basketball court. Tails clear. Roger.
Helimed 55's arrival has attracted the attention of bystanders, who must move back to escape the powerful downwash created by the helicopter's rotors.
Going to come left. Hopefully they'll stop videoing and move out of the way.
20.
Move out of the way. Landing on. Roger. Clear doors, clear and strap. Stay in the distance. Shut down, please.
Aircraft Heliwind 55 on the ground.
Thank you.
Emergency control has sent a vehicle to pick the crew up, saving them a half-mile walk to the scene.
Hello, mate. Yeah, good. How are you?
We really want to be by the patient's side as quickly as possible. So an ambulance getting us there is really crucial in saving those valuable seconds and minutes. When we approach an incident scene, the first thought is looking for any safety issues. And then we're also looking at the scene to give us clues as to how this incident has occurred.
55 with patient. Hiya, guys.
Right, so this is Idris. Idris is riding on the scooter. He's been knocked off by a car on this road. Put top to toe, so he's got the obvious head injury. Yeah. He's tender on the ribs on the left side, but I can't see any obvious kind of fractures or in the abdomen. Can't see any contusions or anything.
But he's tender in the abdomen?
Yeah.
Okay.
It looks like he's got a possible open tib fib on the left. He's had 5 of morphine and he's had a gram of TXA.
Nice.
It's really important that we listen closely to the handover from the ambulance crew that are on scene before us. Equally, then we need to go on and make a detailed assessment ourselves, as we're going to use that information to make really important decisions about that patient's care.
Idris, I'm Simon. I'm a doctor with the air ambulance. How are you doing? Not so good. Where's it hurting? Pointing to your left leg, yeah? I need to have a look at your chest. Sorry, it's a bit cold. Is it sore over this side of your chest at all? No? Okay, well done.
Well done, you're doing really well.
Any pain here? Yeah? It's sore here, is it? Okay, yeah. Sorry. Okay, all right. I won't do that anymore. Okay. I'm just going to have a look down here. Pelvis is symmetrical. And there's an open fracture, is there? Under there, yeah. Well, it's definitely a deformed fracture, is it? Yeah, okay, yeah. All right, open your eyes. I'm going to shine a light in your eyes, okay? So pupils are 6 on the right.
When someone's got an injury that's caused swelling inside the skull, both the pupils may not constrict normally.
And on the left, equal.
Fortunately, Idris's pupils reacted normally to light, which was reassuring.
Okay, so injury-wise, obviously left frontal wound with the possible underlying frontal skull fracture, reduced conscious level, left chest injury with tenderness but good air entry throughout, likely underlying rib fractures, tender left abdomen, so suspected splenic injury, pelvis is symmetrical, he's got an open fracture left tib fib.
Due to the extent of his injuries, Idris needs to go to a major trauma centre. The nearest is in Cambridge, over 30 miles away.
I'll try to call you. What's the flight time to Addis?
Flight time to Addenbrooke is 13 minutes. Do you have any sort of rough estimation of how long you'll be until you come around here?
Primary plan is packaged into the ambulance and drive round, so that'd be probably 15 minutes.
Yeah, that shouldn't be a problem. Forecast of worst peak weather from about 7 p.m.
With bad weather closing in, the team work fast to get Idris packaged and on the helicopter, while there is still enough visibility to fly. But before being moved, he needs sedation.
Okay, so I'll give him 1 milligram of Mataz and 30 of ketamine.
Children obviously come in varied sizes, from newborn babies up to adolescents. So we work out drug doses dependent on their weight, if we have it, or an estimate of their weight according to their age.
Oh. My dad's 1 milligram at 1755. Please, I'm just getting the
A nice chatty thing up there, guys. That'd be lovely.
So,
Nice.
1,
Really well.
2, 3 mils of ketamine. If you can just let that run now, please. Just run a bit of fluid in.
Now.
Okay, so that's at 1756.
All right. Well done. Well done.
Ketamine is a drug that we use for sedation quite frequently in pre-hospital care. It's a good painkiller. It removes awareness of the situation. So it's a very useful drug for us.
So we need to be nice and gentle.
1, 2, 3, roll. Lovely.
I can't see any wounds or bleeding.
Okay.
Spine is straight. Okay, Scoop's coming in with the splint.
1, 2, 3. Lovely. I'm just going to put it.
Oh.
Well done. Well done.
Do you want a little bit more ketamine? So we've still got to do.
I think he's pretty dissociated.
Okay.
I'm happy with that.
Keep going, keep going, keep going.
Okay.
Lovely, and I'll just get that sock off.
If you can just check his pulse down there as well.
There are two main reasons for splinting Idris's leg. One is to relieve his pain and distress, and the second is to prevent ongoing damage to the muscles, blood vessels and nerves.
Yeah, that's
All right, so let's get the scoop locked in, please.
that in. Lovely. Right, let's get him packaged.
I'm just going to check where the car is. Just by my colleague. Oh, there, okay.
I want to see what damage there is to the car, which has been caused by parts of Idris's body hitting the car. And that enables us to build up a picture of what injuries he's got, where they are, and what's likely to happen in the coming minutes.
Okay, yeah, so bullseye there. Fine, that's all consistent.
But just as Idris is packaged and ready to move, the pilots radio with an update on the weather.
Oh, go ahead.
The weather's coming down towards limits and due to get much worse below 700 feet. So I think it's probably best if you're able to do a road move to Addis, we will make a move back to base.
Yeah, roger that. We'll go by road. Thank you. Craft, the weather's coming in, so they can't fly. Who's on the ambulance? Yeah. You too. Cool. Is that okay? Yeah. Cool. Okay.
Okay, so we're going to go on lift. So ready, brace, lift. Just tell us when we're level top.
Yeah.
And down. Okay, straps on, please.
Oh yeah, well done, mate. You can use that one. Right. There it goes. You got it? Yeah.
Idris will be taken to the major trauma centre at Addenbrooke's Hospital. Simon and Lou will travel with him in the back of the ambulance, and Helimed 55 will return to base. It's Sunday morning at Cambridge City Airport, one of two operational bases of the East Anglian Air Ambulance. The charity covers Norfolk, Suffolk, Cambridgeshire and Bedfordshire. Operational 365 days a year, the team respond to nearly 3,000 incidents annually.
Seven-year-old female, crew on scene, they're unable to manage a patient's pain and low blood pressure. I believe this is a dialysis patient.
Pain and low blood pressure, crew request, dialysis patient, okay.
To my side is clear. Okay, lifting.
Today's medical team are Dr. Sarah McNeely and critical care paramedic Joe Dowsing, and the pilots are Eduardo Prato and Andy Morehouse.
Okay guys, ETA 49. Thank you.
The patient is in Chatteris, a market town 18 miles away in northeast Cambridgeshire.
Is this on the nose, do you think? Mate? No, that's it. That's right. Okay. Okay, cool. So I'm going to make a circuit just to warn anybody that's there that we're coming in. Echo Alpha, Anglia 2, overhead scene, over. 250 feet. 250. Okay, I'll put you down here. Jump. Echo Alpha, Anglia 2, landed on scene, over. Okay, leave us all the way down, fellas. Neutral, clear to unstrap, clear doors. Thank you very much.
Thank you.
Mate. Happy days.
I do, yeah. Thank you. Hello, I'm Sarah. This is Joe.
The patient, Gillian, has a lifelong kidney condition and was unable to get out of bed this morning due to excruciating pain in her abdomen. Her husband, Steve, called for an ambulance.
Should I jump into the
Yeah, go for it, yep.
Unable to stabilise Gillian, the land crew called on the air ambulance.
Hello. Hi. My name's Sarah. I'm one of the doctors with the air ambulance.
Okay.
Gillian, can I ask you a few questions quickly before I have a look at you? How do you have your dialysis? You've got a Tessio line in there?
Yeah.
Okay. And when did your tummy pain start?
4 weeks ago.
4 weeks ago. And have you seen anyone about it? And what do they think?
Infection. Okay, with antibiotics.
He's on call, mops.
Okay. Infection of what? Your gallbladder?
Intestines.
Intestines. And when did the pain get really bad?
Hours ago.
A couple of hours. Okay. Is your tummy quite swollen for you?
Yeah, very.
Can I have a little feel? I promise I'll be really gentle. Can you show me where it hurts most? All over there. All right. No pain anywhere else? Where are your kidney doctors based? Cambridge, Addenbrooke's.
Although full-time mum Gillian undergoes dialysis 3 times a week to cleanse her blood, she is usually fit and well.
How long have you been on dialysis totally? All right. Fine. So, I think we need to get a drip into you first off.
It's important to get an IV line into Gillian. She's extremely unwell, and it will allow us to start resuscitating her with fluids and to give her painkillers to treat her pain.
Do people normally have trouble getting a vein?
Yeah.
Sorry, you're being very brave. No, fail. No such luck.
Would you like the
Yes,
scanner?
please. It's going to get our ultrasound scanner and see if we can get a drip into you that way.
I think Gillian is very difficult to cannulate because she's very, very dehydrated, so her veins are all collapsed down.
Okay, we are live with the scanner.
Oh, happy days.
The scanner uses sound waves to produce images of veins and arteries in the body.
Oh, look at that. No, it's all right, I'm happy. So, there's a brachial artery. There's, I think, a vein.
Gillian, I'm just going to have a look at your other arm. Just tell us if you're uncomfortable, all right?
Oh, veins are very tricky, aren't they?
I know, sweetheart.
Scratch coming in your left arm. So, you're going to stay really still a second.
Yeah, if you just bring, I'm just going to guide it.
Yeah.
There?
Yeah. Oh, can you see something?
Might be, but I'm not sure.
See?
It's very small.
Yeah?
See it?
Yes, I do.
It's just about palpable.
Absolutely, go for it.
Not really flushing.
I'll put it back a tiny bit. Now it is.
Sorry, sweetheart, nice and still.
Yeah, tissue, isn't it?
How are you going?
No.
Very collapsible, aren't they?
Yeah.
However, even with the help of the ultrasound, they fail to get access to Gillian's veins.
Some patients are very difficult to get a cannula in.
No such luck.
And that's just part of our job. And so sometimes you have to think laterally and come up with alternative solutions.
So I would almost never touch a patient's Tessio line because of infection risk. However, we've tried to get IV access for really quite a long time now.
The Tessio line is a soft plastic tube connected to a large vein in Gillian's chest, used to transfer blood during dialysis.
And actually, I think we just need to get a fluid bolus into her. Yeah. Gillian, can I use your Tessio line to give you some fluid and some pain relief?
Using it to give fluids and painkillers could introduce infection.
So what I will do, I'll go and wash my hands properly in the sink, put some sterile gloves on.
Doctor, you got it?
I'm worried that Gillian is in septic shock and her blood pressure is very low. So It's important to give her fluid to get her blood pressure a bit better before we try and move her.
Septic shock is a life-threatening condition and is the most severe form of sepsis, commonly known as blood poisoning. Sarah explains her plan to Steve.
And her blood pressure is very low, and I'm actually quite worried about her. And I think that it's probably the best way I can get some fluid into her quickly and some pain relief into her quickly, and we can get her off to hospital. Is that all right? Yeah. Thank you.
Steve explains that Gillian's condition is something she was born with.
Jill's got cross-fused kidneys.
Okay.
Yeah, they never separated, so.
Cross-fused kidneys, or renal ectopia, is a rare congenital malformation. Instead of being on either side of her body, Gillian's kidneys are joined together on one side.
Cool. I just want to clean this really carefully. Lovely, thank you. Will you just open that for me? Thank you. And then the next thing I want you to do is just whip the dressing that's over the top of the ends of it off. Magic.
Any bacteria on the end of the line could travel straight into Gillian's bloodstream.
Right, really, really good clean. Okay. Let's run through. Okay, that's attached. Okay, good. Will you get our monitoring on?
Yeah, I'll sort that.
Cool, thank you. All right, Gillian, how are you feeling? Pretty ropey.
Gillian, can I just put this blood pressure cuff on your arm? Is that okay? Thank you very much. Thank you. That's just going to get tight on your arm, okay?
Her hands icy cold.
Blood pressure of 47/31.
Yeah.
A normal blood pressure is around 120/80, whereas Gillian's is much, much, much lower than that.
Is blood pressure cycling again?
Yeah, 60/36.
Good.
With fluids now running, Sarah can also give Gillian pain relief.
Okay, a little bit of painkiller coming up now. It's just the bit that you've really been waiting for, isn't it? Okay. Bit of fentanyl. I think we need to get moving because there's a limit to how much more we can do here.
Yeah.
Gillian, has that made your pain a little bit better? Yeah? Right, Joe, I'm going to leave this bit to you.
Giving Gillian fluids and painkillers has allowed us to safely get her down the stairs and into the ambulance.
Before we go, okay?
And the most important thing now is to take her quickly to hospital.
Gillian, you're doing really, really well.
On left then, ready, embrace it.
Fantastic. Right, good.
Sorry, sweetheart.
Right.
She's still silent, she's still got a good end tidal, sats are a bit low and blood pressure's cycling.
Right.
Well done, Gillian.
Gillian?
Gillian will travel in the land ambulance because it's smoother and more comfortable than flying. Sarah and Joe will closely monitor her condition until they reach Addenbrooke's.
Okay, let's go.
North Weald in Epping, home to Essex and Herts Air Ambulance.
Good, that's checks ready.
Every day, the charity's highly qualified medics take their critical care skills to the roadside to carry out life-saving interventions on scene.
Clear. Tail's clear.
With the helicopter prepped and ready to go, the crew of Helimed 55 are standing by for their next mission.
Oh.
55, good afternoon. Go ahead, please, with the grids.
Tango Quebec 780.
780.
849. RTC is a motorbike, unconscious.
Okay, we're on our way, Keith.
Helimed 55 has been asked to attend the incident by colleagues at the East of England Ambulance Service, who are already on scene.
Lifting. Clear to the left.
Alexander Johnstrom is today's doctor on duty, alongside critical care paramedic Ben Finbow.
Modellers aren't active. Roger, roger. Bit of a tailwind, isn't it?
The location is 20 miles southeast of the airfield in Canvey Island, an area of reclaimed land in the Thames estuary.
It's Got lots of green areas all around.
The job we're going to is car versus motorcycle. So depending on how the motorcyclist has fallen off their bike, we'd expect to see head injuries, possible chest, abdominal and pelvic injuries.
Right, so 2 minutes to run, guys.
Thank you. Oh, so there's the tennis courts. You've got the golf course to the left.
We can go to the car park, approach over the top of the actual football field area, and we're coming that way.
All right.
50.
Okay, all clear left. We're all good. We're all good.
This is a good place for loading as well. Yeah, brilliant. Okay, guys, and settling down.
Cheers, guys.
Sorted. Let me take it, mate. Element 55 with patience. Hi, guys.
Just a heads up, guys. I was saw motorbike rider coming around the roundabout. He's collided with a vehicle.
Motorcyclist Sol was on his way to meet family when the accident happened.
Thorax is clear, upper limbs are clear. The problem lies with the right leg. We've pelvic pain. He's got clear a mid-femur fracture. He's on his fib on the right side as well.
Hey, mate. Solomon, I'm Alex. Are you allergic to anything? No. On any medication? Had anything to drink or anything today? No, okay. Where's your pain the worst at the moment, mate?
Oh, my leg.
Your
My
leg,
leg's
okay.
so sore.
What's happened, mate? Hey, mate.
In Canvey Island, Essex and Herts Air Ambulance are treating Sol, a motorcyclist who collided with a car on a roundabout and has multiple injuries.
Oh, it does. They're going to give you some more pain relief,
While Dr. Alexander Johnstrom does a primary survey, Sol is given initial pain relief.
Take this in your hand, just get in here. Put this in your mouth. Take some deep breaths for me. Right. Breathe it in. See, breathe in with it. Oh, that's right. Breathe in through your mouth. There we go.
As well as the Entonox administered by the ambulance crew, Alex gives Sol fentanyl, a powerful and fast-acting opioid drug which the HEMS team are licensed to carry.
Yeah, that's 50. Check. Flush. Right, so...
Should we take...
Top to toe, we need to take the helmet off and have a proper look, but chest seems clear. We've got bilateral air entry. Abdo is soft.
Yeah.
Query pelvis. There's quite a lot of damage to the petrol tank.
The right-hand side.
Yeah.
Sol's pelvis may have been broken as he hit his bike's petrol tank during the crash. A broken pelvis can bleed catastrophically and is a time-critical injury.
So open femur, query pelvis, possible head injury. So trauma positive.
I think we get helmet off.
Yeah.
Excellent.
Just start holding his head like that.
Sorry, mate. Right, yeah.
Sol's head is supported to prevent further injury to his neck and skull.
Oh, I don't want to do this anymore.
I know, mate. We need to get you to hospital first.
Removing Sol's helmet reveals a worrying sign.
Have we got it?
Yeah, got it.
So we've got blood in the ear. Let's have a quick look.
Has it gone quiet enough?
Yeah, it's coming from inside the ear canal. So suspected base of
query
skull.
base of skull. Okay, so...
With a possible head trauma to add to Sol's list of injuries, the team must decide the quickest and safest way of getting him to hospital.
Right. So, I think as far as packaging, I don't think we can do that without sedation. So he went quiet again just then.
Yeah. Sol going quiet could indicate that he has a base of skull fracture and a potential bleed on his brain.
We'll RSI him before flying.
So pop this up your nose, my friend, all right?
No, that and then onto that.
RSI is rapid sequence induction. Sol will be placed in an induced coma and the team will take control of his breathing. It's a life-saving procedure which can only be carried out at the roadside by advanced trauma teams.
I think so, yeah. I think we'll package as we are.
Yeah.
He's had 100 of fent.
Yeah.
Seems manageable now. So if we scoop onto trolley and then RSI.
Happy with the location of that?
Yeah, that looks good.
That's fine. And we're clipping at the top. And on your shout.
Sit down. Brilliant, guys.
Ben prepares the drugs and equipment needed for the RSI.
Excellent. So 1, 2, 3, 4, 5. That's fine. Cool. Right. Ketamine, rock. It's fine. Are you all right to set that section up for me, please? Top man.
Right, so guys, if you want to bring the head end over by the oxygen cylinders.
You're doing really well, buddy, all right? We're going to take care of you.
So what we're going to do, because you're in so much pain and because we think you've hurt your head, is we're going to put you to sleep just so we can fly you to the right hospital, okay?
don't think I've hurt my head, it's just my leg.
No, you're bleeding out your ear, mate, and you're bleeding here as well.
Oh, shit.
Yeah. So we need to just make sure that we've got full control of you. I'm going to give you some medications now, all right?
What?
Go take the pain
Go
away.
to sleep for a bit,
What
okay?
type of medicine?
Look at me.
Just look at me.
Just think of a nice sunny beach, mate.
Uranium. 5, 10, 15.
These drugs will sedate and paralyse Sol.
So 15 of your 9.
Yeah, so pulse rate's come down. So just keep an eye on the sats for me.
I'll keep an eye on the sats.
Right, so we've got tongue.
Sats are 100%.
Tongue. Okay, I've got epiglottis there. You get a bit of pressure. Quite deep, right, straight to the view.
The crew must work quickly to get the breathing tube into his airway, as he is no longer able to breathe for himself.
With that.
Tube is coming. I've got the bougie.
I've got the tube. Tube is through the cords there.
Okay,
22.
bougie's coming out.
Yeah.
Bougie is out.
Okay.
We've got colour change.
Colour change.
Right.
Yeah. Chest voice.
And I've got a waveform CO2.
I'm coming
Sats
out.
are 100.
The crew are now in control of Sol's breathing.
Pupils are equal.
And then we go up in the bed. Okay, has everyone got a bit?
Yeah. On 3. 1, 2, 3.
Okay, got that? Lovely.
Alex pre-alerts the trauma centre.
It's a motorcycle versus car, 20-something-year-old male. Query base of skull, query open buck pelvis, open femur, right-hand side. He's had an RSI. Thank you very much.
Right, move flusher up.
Get it going, baby.
Okay, we got clear left.
And you are good to the right.
Okay, Jody's on the amber strike 2 en routers. Roger. Is he sick, guys, or is he?
He's not dying, but he's not well.
Okay, understood.
Okay.
Okay, clear left.
And you are clear
Roger,
to the right.
and we're lifting.
They're flying 27 miles west to the Royal London Hospital in Tower Hamlets. During the 13-minute flight, Alex and Ben continue to monitor and treat Sol.
I'd give a milligram of Badaz, yeah. And then I'd probably increase his rest rate a bit. Yeah, 28.
28, yeah.
Okay, and landing on. Okay, you're clear to unstrap, guys.
Thank you.
Okay, and shutting down.
Right, ready on 3. 1, 2, 3.
Watch out, watch out.
Stop.
Right.
Sol will be taken direct to the emergency department, where a team of specialist doctors and nurses are standing by, ready to treat him.
Securing the back. We're secure the rear. My says clear. That says mine. Lifted.
It started quite early in the morning. Jill was in an awful lot of pain, excruciating pain. She was basically lifeless. I was very worried. Probably one of the scariest things I've seen.
I do remember the paramedics coming, and I do remember the helicopter landing, but that's it. Just very worried and scared. I was worried about my kids. I didn't want to leave my kids.
In total, Gillian was in hospital for almost 3 months.
It's been difficult, especially when she first came out of hospital. But just to have her back home and see her laugh and smile and be with James and Lily, that was worth it.
It's been just over a year now since I've been home. Life now is good. We're doing okay, aren't we?
We're doing very well, actually. Very well.
Yeah.
I think, if anything, the experience has made a little bit closer.
Yeah, definitely,
Yeah,
definitely.
so-
Yeah.
But no, things are on the up. Not
Yeah.
looking too bad, so
Yeah, it's good.
good.
I have to do dialysis 3 times a week. You know, I want to go back on the transplant list so I can get my life back. I hope the future brings me a new kidney, obviously, a good holiday, and just life, just normal life, watching my babies grow up. Get married, maybe I can meet some grandkids one day. I want to see them happy. The medics that helped me throughout the whole of my treatment are brilliant. Thank you. I really appreciate you saving my life.